Yeah, so growing up, I was really active in sports, and one of my neighbors was an orthopedic surgeon, and we had a take your daughter to work day, and instead of going to work with my parents, I asked him if he wouldn't mind me tagging along with him. So I went with them and observed him in the operating room and really fell in love with it. I remember, I think first procedure I saw was a bilateral total knee replacement, and then we did carpal tunnel releases and a total shoulder, and really a variety of cases that day, and it stuck with me ever since. So I'm looking at the TGF-beta pathway and its role in chondrocyte cell signaling in the growth plate. So there's a few mutations in the TGF-beta pathway, namely I'm looking at SMAD4, and they lead to a variety of different skeletal dysplasias. And what I'm looking at is how the mutation in SMAD4 changes the cell signaling pathways and the cell shape and direction, the polarity of these chondrocytes, because in each layer of the growth plate, the chondrocytes have a very specific shape and a very specific role. Well, in this particular mutation, the cell shape and the role of the chondrocyte has changed, which alters the dynamics of the growing skeleton. No, actually, within the first few months, I had a serendipitous discovery that we found out that there was absolutely no proteoglycans in our mutation. So I started investigating the pathways of TGF-beta, SMAD4, and proteoglycan, both synthesis and the degradation of proteoglycans, and started thinking about, well, it's maybe not, is the defect in our cell intrinsic, meaning coming in from outside the cell, or cell extrinsic, coming from the fact that there's no proteoglycans surrounding these chondrocytes. So it's really allowed me to ask more questions and develop as a scientist, instead of just saying, this was my path that I was planning on setting out, and this is the path I'm going on. I've been able to make a few discoveries and roll with that as I've gone along, and the grant has really allowed me to do that, as opposed to working on somebody else's project that have very strict ideas of where they want it to go. So it's been a really great experience. As I've been interviewing for my pediatric orthopedic fellowships, it's been great going to these different institutions and meeting some of the clinician scientists that they have, and listening to how they've been able to do this dual lifestyle of research, but also a fantastic patient care, and get some of the tips and tricks that they have, because while it is a long and challenging road, I think there's a lot of benefit, especially when you're passionate about what you do, and being able to do that translational work of seeing a patient and asking a question, taking it to the lab, or doing a clinical research study, finding an answer, and then being able to implement it and change it. And that's actually one of the things that continues to push me in research. I had a project in medical school where we had a patient who wasn't growing, and he was smaller than his parents and smaller than his other siblings, and we started doing some literature search and found out that, well, he may have this mutation. We took a blood sample to the lab, we sent it off for genetic testing, and sure enough, he had a mutation in this particular transporter in the kidney, and the solution was to give him phosphorus, and we gave him phosphorus, and he started growing, and you could see changes on his MRI corresponding to this simulation from the phosphorus. So it's things like that that get me really excited about the translational work, especially in orthopedics and growth plate biology. So it's been an amazing experience, and without the funding from the OREF, I wouldn't be able to have the experience that I've had during my research year at UCSF. I would be more than likely put on a project that already had funding. Some things would already be rolling, and while I would be able to take some ownership, I wouldn't have had the opportunities that I have now as really feeling like I'm the principal investigator, managing the budget, coordinating experiments, having people working with me, being able to making some of even the hiring decisions and what steps to take next, division of labor. And I was really able to create my own project from the start to the finish, and it's been amazing. I think it's also a controlled environment where I'm still in my residency. I've got fantastic mentors, which I'm sure I'll have later on, but it feels very safe, but yet I've got some leeway to develop myself and know that this is a part of my future that I want to continue with, continue doing research, continue the collaborations. And without the funding, I don't think it would have been as rich of an experience as that I've had.